There are so many reasons we give ourselves to skip a workout, right? It's either I'm too tired or, I've got too much going on. Oftentimes, achy joints can hold us back, and it's easier to just kind of skip a workout due to those aches and pains. Colder winter weather can even sometimes make it hard to make it to the gym or just even to get out of bed. So here with us today is Tyler Wunderlich, a health fitness specialist with Cone Health, Sagewell Health and Fitness. So let's talk about this because this is common for most of us. When someone's joints hurt, many times the last thing they want to do is exercise. So how do we battle that?
It's really quite simple, just making sure that we're remembering that movement is medicine. Um, Appropriate exercises have been shown to reduce pain from arthritis in multiple people, and it doesn't stop the pain, like I said, but it does reduce it. So just making sure that we're continuing to move and getting active is the most important thing.
I love what you said, movement is medicine. So easy, we're apt to like pop an Advil or something like that. But when you think of exercise as medicine, that puts it all in a whole new light. For someone who might need convincing that exercising won't hurt their joints more, what do you tell them?
So again, just coming back to that movement is medicine, making sure people understand that it doesn't have to be something that's, putting a lot of stress on your body or anything like that. It's just making sure you are moving, getting something done, and making sure that you are active.
All right, so when any of us, or I'll just say me, when I sit for too long, right, when I get up, things feel like, it's a little bit painful kind of thing, like everything just doesn't want to move right. Should you expect a little bit of pain like that when you start?
Of course, part of exercise is muscle soreness. So you will have a little bit of soreness as you begin to exercise. But overall, it can be reduced once your body is used to getting that extra movement in.
All right, so let's talk about exercises that would help with stiff, achy joints, because maybe we're just not doing the right kinds of exercises.
There's really no one size fits all. It's just kind of making sure that you get something that keeps you motivated and you enjoy doing, really. So if it's just going for a walk, that's great. If you want to do some squats at home, or if you want to try, if you don't have any weights or something, you can use books to do bicep curls, just holding a book and doing that. Just anything to get yourself moving and making sure that you're enjoying it. That's going to be the best thing to get you going.
Okay, move and enjoy it. So is this like, should we concentrate on cardio, on strength training, on both?
So again, there's really no one size for everyone. It's just making sure that you are moving. So cardio is going to be good. Obviously, it's going to keep your heart healthy. Strength training is going to help you be stronger, of course. And a little bit of both would be good, but it's just, again, making sure it's something that you can stick with long term.
All right, now oftentimes we become, less active in the wintertime, which can add to the aching joints. How do you prevent doing too much too soon? Because I think sometimes we're like, okay, we're going to exercise, we're going to do this thing, and then we do so much that it just doesn't feel good.
Yeah, so starting off slow is the best way to do it. Just making sure that you're gradually introducing exercise into your routine. You're not going to be starting out at 7 days a week doing, the maximum amount of repetitions or walking for 3 hours every day. It's making sure that you can just ease into it, let your body adjust to your new exercise routine, and then as you get more used to that, you can start to add more.
So don't feel bad that you're not jumping with a whole hour workout. Doing a 15
Yeah,
minute
of
or a
course.
30-minute workout is better than doing no exercise.
Of course.
Okay, so how soon, because I always think about this too, when you start something, an exercise plan or an eating plan or anything like that, you think to yourself, all right, how soon am I going to start feeling the benefits once I get back into a workout routine?
So we get that a lot. But there's really, again, no cookie cutter answer for that because everybody is different. Some people will, immediately say, wow, I feel so great. It's so good. They've got endorphins running and they're just really feeling it. Some people, it can take up to 2 weeks to start feeling, that higher energy level and less soreness or ache in areas. It just really depends on your body, but in general, it's about 2 weeks for people to kind of get used to the exercise and start really feeling things.
Yeah, so stick with it. Stick with it through that 2 weeks. That may be really tough at the beginning. All right, we're going to take a quick break. We're going to be back talking about joints and exercise. Welcome back. Tyler Wunderlich, a health fitness specialist with Cone Health Sagewell Health and Fitness, is joining us. We're talking about joint pain and we're talking about exercise. All right, so let's say the joint pain is in your knee. What exercises are you recommended to do and what exercises should you avoid for knee joint pain?
So, some things to avoid are obviously going to be things that are causing pain in the knee. If, say, doing a lunge gives you pain in your knee, you can try a squat. If that's giving you problems, you can try something like a knee raise, just picking your feet up. If that's still giving you problems, then you can try a seated knee raise, take some of that pressure off of your legs. High impact things like running are also going to be on the no-go list. So that's where you can try things like walking. If you have access, you could try water walking to, take some of that pressure off the joints. Or if you have a bike, that's going to be a good option as well.
Okay, we're going to go down kind of like a list of some of the ailments that we may all have so that we can figure out what are the best exercises to do. Next up is a stiff back. So what are the do's and don'ts if you have a stiff back?
So again, main thing is to make sure that you are not doing anything that causes you pain. So if bending is giving you pain, obviously we want to avoid that. We don't want to do any twisting motion if that's going to give us pain as well. But doing things like a seated back extension, where you're just sitting in a chair and then maybe leaning forward but keeping your core tight, and then sitting back up and keeping your core tight, chest nice and tall, that could be something to do. Or even if it isn't a problem, doing a gentle twist just to get those muscles engaged.
Okay. All right. So you're with Sagewell Health and Fitness where, people go out to work out. There's health professionals there who can help them and all that kind of jazz. But what happens if we're at home and we need to be at home to do our exercise? What are the exercise options that we can utilize at home?
So body weight options are always a good thing for people. So if you have a counter that you can use or the back of a chair, you can hold on to that and you can do body weight squats. Earlier I mentioned, if you have a nice heavy book, you can do bicep curls with that, just holding on to it. If walking is something that you're interested in, then a great option would be going to your local shopping center and walking laps around there, because it is kind of cold outside right now, but inside the mall or around the shopping center, it's heated. So you can still stay warm and get your laps in.
For free. Yeah. Okay. Got
Yeah.
it. Yeah. All right. So when should someone consult with their healthcare provider before they actually start an exercise plan?
So ideally, you're going to talk with your doctor before starting any exercise, just to make sure your heart is working correctly. If you need to be aware of if you have, diabetes or something, about your blood sugar levels, anything that could potentially cause issues. It's just best to start with your doctor, talk to them, and then they could potentially recommend that you come see us here at Sagewell, and that could be an option for you. Or they could recommend that, just becoming more active and doing something like walking would be a good recommendation as well.
All right. So for folks who may need just that little extra motivation to get moving, especially in the winter, what advice do you have?
Really, it's quite simple. Just getting yourself determined to do it. If it takes, buying that pair of pants that you want to fit into, that's great. If you have a picture of yourself at a target weight that you used to be, that you want to work back towards, hanging that where you can see it. Or if it's just taking a sticky note and putting it on your bathroom mirror every morning, saying something like, "You can do this, you've got it," that's going to be a great option as well. Whatever is going to get you moving and get you determined to do it. That's the best advice I can give.
Yeah, talk to yourself nicely and be like, come on, we can get out there. We can do this, even if it's for just 15 minutes. Let's try it.
Exactly.
Yeah, talk nice. Okay, thanks so much for your wisdom and your expertise. You know what, if you missed any of this segment, you want to learn more about Cone Health Sagewell Fitness, it's going to be at WFMYnews2.com.